Hello everyone, I'm Dr. Irfan Yaqoob, Senior Consultant Interventional Cardiologist working in Kailash Hospital, Dehradun. I would like to extend my gratitude to all the organizers, to the technical staff, to sponsors and the individuals who had made this academic feast possible. It is well organized conference. It covers all kind of interventions related to cardiology and peripheral vasculature. So I had come here to present my three cases. The first case I had presented was that it was related to the accordion or concertina, how it can affect the decision making and how it can make your intervention complex. It was previously thought that concertina is a benign thing, but sometimes it may not be so, or it may make your intervention complex. That is what I presented in my first case. My second case was a complex bifurcation lesion where we have done mini clot and mini crash in the same patient at the same time, where patient had diffuse calcified lesion in left coronary system. So third case was a peripheral intervention where I did left subclavian artery stenting in a patient who had multiple syncopes over last 3 years and was evaluated without any diagnosis. And this stenting of left subclavian, which was totally occluded, it has relieved him of the symptoms. This patient actually had a vertebral steal syndrome that got relieved after angioplasty of left subclavian artery. So once again, I would like to congratulate the team for organizing this wonderful event and making this academic feast possible. Thank you.